right? Here are some other important considerations before we get down to whether or not you should actually use manual therapies in your practice. So patient and provider expectations are going to influence the outcomes for your patients. So if you utilize a technique a patient has a positive belief towards, let's say an individual really likes manipulation, right? And let's say they've had a positive experience in the past with manipulation, we know that they're probably going to have a better outcome with manipulation, okay? So this means that maybe we need to push the treatments patients have had success with. I can't tell you how many times I've had a patient where I thought I did a brilliant job with my diagnosis, my plan of care, my exercise selection, and gave them what I thought was the best care. And they come back and tell me, you know what, Dan, I think the reason why I'm getting better is because I'm using this stim pack every night. I think the heat pack on my lower back with the stim is really helping me. Let's keep doing that. And, in my head, I just want to be like, what are you talking about, guy? Come on. Come on. It can't be the heat pack or the e-stim, really. But in reality, that's what the patient believes, and they're having a good experience with it. So we know that to be true. And the other piece is that, if we give the patient a positive expectation of treatment, they're probably going to have a better outcome. We have some research that shows this, right? And I included an article by Bishop et al. That talks about this. I've also referenced Joel Bialowski quite a bit in this presentation. And if you want to read some of his information, again, I'm going to put that in the show notes. But I really highly recommend you read this because it's going to give you some good information about whether or not you should be performing manual therapies. But if I tell a patient, look, I have this treatment. It's called dry needling. I put this needle inside your muscle. It's definitely going to help you out. I've had a ton of success in the past, and I think you're the perfect candidate for it. They're probably going to have a better outcome than if I say, hey, there's this treatment. It's called dry needling. Sometimes it works for people, but majority of the times it doesn't. I don't think that you're the right candidate for it, but we're going to give it a shot anyway. Who knows, right? It might help. That's not going to have the best outcome, right? So if we talk up this treatment and we give it a positive outlook, then we're probably going to get a positive outcome with it. So the other piece is that Therapeutic Alliance is very, very important for our outcomes. I got to tell you, people love manual therapies, all right? How popular are chiropractors, massage therapists, acupuncturists? I can't tell you how many people just absolutely love these folks. They have a very, very strong Therapeutic Alliance, right? And here's the thing, if you have something that's going to really help to build a therapeutic alliance, maybe we should consider using it, right? I'm obviously not going to force it, but if people really, really desire that, and that's going to improve my therapeutic alliance, I'm going to give it a shot because I know that that's going to improve my long-term outcome, right? And lastly, patient expectation is going to influence the outcome. We already talked about this before, but if the patient expects improvements, they're going to have a better outcome. Right? If you have a previous positive experience doing a manipulation or dry needling, they're probably going to have a good outcome with the same treatment again, right? I can't tell you how many folks have told me, yeah, I'm a really good responder for dry needling. I just do really, really well with it. And this is not just in patients. I've had physical therapist students that tell me yeah, I love dry needling. I just respond really well to it. And I got to tell you, that's very, very true in my own experience. I've had folks that seem to do extremely well with a certain intervention. Just when you needle my upper trap, it feels phenomenal. I feel really, really great after you do that, right? And the other thing is that some folks do not have a positive experience, right? And, we're going to talk about this a bit later, but maybe we don't needle those folks. Maybe we just work with the folks that have a really good outcome from the specific treatment. And the other thing is that provider expectation is going to influence the outcome. Like I said before, this treatment will help you versus not sure, we'll give it a shot. So if I really talk up my treatment, it's going to help me have a positive outcome. And again, Therapeutic Alliance, very, very important. If I have a better alliance, I'm going to have a better outcome. If I have a poor alliance, I have a worse outcome.